Well, welcome to Making Treatment Decisions at Gilda's Club, Kansas City. This is Anita Slusher, and I'll go ahead and let her introduce herself, and we'll just go on with our program here tonight.
Hey everyone, welcome to Gilda's Club's Frankly Speaking About Cancer and Making Treatment Decisions. My name is Anita Slusher. I'm a program specialist with Gilda's Club, Kansas City. So happy to be here with you tonight. So I hope you enjoy this. A quick overview. Obviously, we've done the introductions. We'll just be talking about some treatment planning basics, talking about treatment teams, setting goals, what are guidelines and pathways, different options. We'll delve a little bit into the caregiving aspect, and then of course, once we have completed recording, we can do any questions you might have. These slides were medically reviewed, as you can see, by Thomas LeBlanc, so that it is new because that happened this year, so that has been updated for 2020. And it was developed by the Cancer Support Community. So Gilda's Club is an affiliate of the Cancer Support Community, just so you know that. And it's all been developed independently with experts to review it, and CSC does have final control over the programs, but it was sponsored, just so you know, by Pfizer Oncology. Also, just so you know, I have no financial relationship to Pfizer. So the objectives. We want to help you learn what your treatment needs are and how best that you can respond to that so you get your treatment needs and objectives met. Help you to get more knowledge and how to find out about your diagnosis and those options, building a support system, being able to advocate for yourself. We'll talk a little bit about that. And again, the information for any caregivers around making treatment decisions. And we definitely want to help you be able to make choices that are right for you. That's really important. So as far as tips for being newly diagnosed, educate yourself. But I say that with a grain of salt because there's a lot out there that can take you down a rabbit hole you don't want to go down. So start by going to trusted sources. Don't always trust Dr. Google. Let me put that out there. Going to trusted sources like the Mayo Clinic, like Sloan Kettering, sometimes the places like Harvard. Those places are going to have good information if you're going to go to the website. You can also talk to your doctor, your nurse practitioner, or a nurse navigator, or even a social worker if there's a social worker available on a treatment team. And they may be able to give you sources that you can go to that are trusted and trustworthy, but it's really important to always stick with those trusted and trustworthy sources. Get support that you need. That can come anywhere from family support to Gilda's Club or Cancer Support Communities, if that's what's available which is what's available in different states, but just putting that out there. Support groups, individual support. There are also agencies like one that's called A Merman's Angels, and their goal is to set you up, both caregivers as well as those who are diagnosed. Their goal is to set you up with individuals who have the same diagnosis and are maybe further along in their own progress and their own healing, who have asked to be mentors to anybody looking for that. So that's a really good source. And always have hope and courage. So be willing to, don't give up. If you have questions, ask them, and we'll get into more of that too, those questions. So treatment planning basics, things to talk about with your medical team. So your age. In certain cancer diagnoses, your age can decide what's available for you for treatment, but what will be the best for treatment. So that's always something to take into consideration and ask questions about. Where are you in your life? Are you at a point where you're still taking care of young children? What's your work situation? Are you further along in life? Are you looking at retirement? Kind of where are you in your life? How is that going to be affected by treatment? And what will your expectations be about how treatment will affect you and what you want to be capable or able to do? What is your current overall health, barring the cancer diagnosis? This can make a difference too. Sometimes some treatments are harder than others on the body. So just talking that over, how deeply will this affect my overall health? A lot of times there are white blood counts and red blood cell counts that can affect what happens. Just I do want to make just a quick clarification, because I am not a doctor, so specific medical questions I won't be able to answer, just saying that, putting that out there, but we'll see, we'll do our best. Again, I kind of went over expectations for treatment. What does that look like with the goals that you have and the things you want to accomplish while you're in treatment? Available resources and a support system. Identifying even your support system. Is that a good friend? Is that a sibling? Is that a spouse? Is that a support group? Is that individual counseling? All those things that can potentially be available. Logistics. What do you need for transportation? Do you have reliable transportation? Will treatment affect your ability to drive yourself? Do you need to make plans for somebody helping you as far as transportation goes? Costs, it's checking into what is covered by insurance, what potentially could be end up being out of pocket, what might be out there as resources for covering costs. These are things that if you have a nurse navigator or an oncology social worker who's working in your team, those are things that they can help with. And then any additional questions you might have that can, have a wide range. So setting goals as far as empowerment approach, setting goals, plan a strategy for each goal, find the resources, ask for help, don't do it alone, and take action. We're going to get into a little bit more detail on each of those further in as we go. So treatment decision making equals shared decision making. So it's always good to talk everything over. This includes treatment teams and family members. In the end, the treatment decision is yours, no matter what. But you can get good insight from family members who know you, from spouses, from friends who know you, and you can get good insight as far as expectations from treatment teams, from the doctor, from the nurses, from nurse practitioners, whoever may be there. Again, that shared decision making is relationship based. So hopefully, in the best of circumstances, you have a doctor that you're happy with, that you're comfortable with, that you've been able to develop a relationship with on some level. One of the things we know is that some people want a physician who has a very good bedside manner. And there are people out there who are less concerned about the bedside manner. They want to know that they have a physician who's got all the information, who may be the best in their field. So however that relationship looks for you and feels comfortable for you is good. And it's going to be you and your healthcare team discussing the treatments that are available to you. There may be multiple choices, there may not be. So all of those things need to come into play when you're making your decisions and making them around your treatment, as well as values, goals, what your living situation is. Again, some of those logistical things that may come up for you. So let's talk a little bit about setting goals, because there are multiple life areas. And it's really easy for us to set really big goals, and that's great. And maybe we set that really big goal and then we break them down into smaller goals that eventually reach that big goal. So as far as physical health, emotional health, sexual health, and just general well-being, what is it important for you to be able to do? Do you want to be able to play with your kids? Do you want to be able to go to perhaps ball games? Do you want to be able to play with your grandkids and participate in their activities? I know life right now with COVID is a little bit weird, and even those things are not quite as accessible as they were, but those are still important things to think about. What do you want to be able to do physically? Do you want to, is your own like workout time important to you? Is that time that you take for yourself that you still want to be able to do on some level? Some people find that they're still able to maintain the same level of exercise as they had in the past. Some people find they need to dial it down, and just talking about what part of that is important to you and how can you, are there ways that can help you maintain those things that you want to be able to do? Family and social relationships. What's going on in the lives of others that's important to you? Again, that goes back to kids, grandkids, those friends, those things that you want to be able to participate in with them. Do you want to be able to still have that social time, or maybe you had a monthly meal with a sibling or a friend that was something that was really important to you? How is that, you still want to do that? How can you manage that? What might have to shift and change? Do you start calling and picking it up and bringing it home? Those things that you maintain to help you maintain just your own sense of self, your own sense of still having enjoyment in life, those things you need to do. Work, home, and school. Do you need to continue working? Many people do need to continue working, and they have to find a way to do that. Sometimes you can go part-time. It depends, you know, that's just something you need to think about. Is that something you want to do? Is that something you can do? Is part-time an option even in your job? Can you adjust schedule, responsibilities? What career goals have you had that maybe you've got to adjust a little bit or shift to push it out a little further, those kinds of things. Any other responsibilities? Are you getting the help you need at home? So found that many people are willing to help with house cleaning, you know, kind of checking into those things, even like meal trains and meal plans and things like that. There are many friends out there who may be willing to help with those things, help with cleaning, help with childcare, maybe even help with transportation of getting kids to where they need to go if that's not an option for you, or if you come across difficulties in making that happen. And it can be good to kind of set that up and talk with people early on, because it may not be something you need immediately, but know that they may be available to you should you need that at a later time. What is your community involvement, and how much do you want to stay involved? Are you doing volunteer work that you still want to be able to do, but you may, again, physically with treatment, may be more difficult to do? So you might have to shift that as well. Think about shifting that, and are you okay with shifting that? Maybe going down to once a week instead of 2 or 3 times a week. Or if you want to do 2 or 3 times a week, can you do shorter hours in that? Is staying active in your community important to you during this time? Those are all really good things to be considering and talking with your treatment teams about, talking with your support systems about, all of that to make sure that you're getting what you need during treatment. Personal and spiritual growth. Are you taking care of yourself in those areas spiritually and emotionally? If church is important, whatever church looks like for you, is there still a way to maintain that connection with your church community, with the people there? You still getting involved in the personal growth things that help you, that you want to be doing, that support you emotionally? And again, is there a way that if you can't go someplace, and again, in this time of COVID, going someplace and participating is much more challenging. So we do have the option for most things anymore to be in an online platform to do that. Makes it a little easier in some ways to be supported emotionally, more difficult in others, but will that be an option? And then just other areas, anything that you can think of. What else is important to you? Are your pets important to you that you want to still maintain? Walking your dog, those sorts of things that help you, being able to play with your dog, take your dog out back, whatever that looks like, or any other pets and other things that may fall into that other category, things that may fall into that other category. So to do much of this, it is important to understand your values and really think about what is important to you. And many of these things I have addressed in some fashion. So if it's being active with your family, how can you still maintain that? Um, we have some members who have very few side effects to treatment. It just kind of depends. And some people who have huge side effects to treatment. So, but being clear about what those things are ahead of time so that you can maybe be a little proactive about maintaining the values and those things that are important to you, especially if it's being active with family members. If there are things you want to attend, things that maybe in the future that you want to be able to attend, a wedding, a graduation, something like that that you know is coming up, and being healthy enough to do those. Many people do value having few side effects, and there are a lot of options now for managing side effects ahead of time. So being proactive about those side effects. There are medications that can be taken perhaps for, just as an example, for nausea. That may be an option for people to help with any kind of nausea. So talking to your care team about what those things may look like, what's important to you there. And for some people, if they have side effects, they really don't care as long as they're getting that best treatment that is available. So, thinking about these things long and hard to make a decision around them. And for some, they want to be a part of a clinical trial to help either advance science. And for some, it's there may be traditional or current treatments that aren't working as well, but a clinical trial is an option for treatment to continue being healthier and getting the treatment they need around the cancer. So some tips for all of this. There are a lot of decisions that are going to need to be made. So again, I kind of mentioned this earlier, breaking that process down, maybe breaking those goals down into smaller steps, creating smaller goals within larger goals, that each small goal being met with those steps takes you one step closer to that larger goal. So breaking that down into things that feel more manageable. It's very easy to get overwhelmed, especially initially with the cancer diagnosis. So what are the things that will help you to be able to reach those goals and feel less overwhelmed with that? And who can get involved to help you with that? Know where you are and where you're feeling about everything within that process. This is not going to be something that's going to come immediately. Again, you can be in that overwhelm, so that may be when you need to find that trusted friend, that trusted counselor, whoever that is, to kind of help you start processing within that overwhelm and bringing things in so that you can think about those goals and what's happening and how to start breaking things down into much more achievable steps. And again, work with your doctor, work with your team to create that treatment plan. And if you can get a written treatment plan, fantastic, because that gives you something to follow and some idea of what will be happening and the steps that will be happening along the way for all of that. So understanding the diagnosis. Talk to your doctor about exactly the kind of cancer. Talk about staging. Have them write it down for you, or if you're comfortable taking notes, take those notes. If you feel like it overwhelms you and overwhelms your brain to get those notes and to get all that information, ask someone who's come along with you. Ask somebody to come with you to help that be a second set of ears. I know that that's becoming more possible to do with many of the hospital systems allowing one person to accompany a patient. There was a time when that wouldn't have been possible and that would have been much more difficult to do, but that is opening up a little bit. Ask for a copy of lab reports. And if the hospital you're with or the system you're with has a portal such as MyChart, many of your lab reports will be available on that. Feel free to look at those so that you can look at that and ask questions. And because those can look like a whole different language if you've looked at them and you've never had to read them before. So look at it, ask questions, and don't hesitate to get the information you need and ask the questions that you need. A lot of systems do have an oncology social worker or a nurse navigator who may be the person who is the most available to you for asking questions. So be in touch with them if that's an option. Ask your doctor what they base their treatment recommendations are. Why are they choosing this particular treatment for you? What factors went into that? And again, talking to other people who have had any cancer, and if you can talk to someone who's had the same diagnosis, see what they have to say and what their experiences have been. They may be able to point you in a direction that you didn't even ever think about, because they've been there and they know what either they wish they had, or they know something came along for them that helped them make a decision or move forward that came through unexpectedly. And that's where the things like a Merman's Angels can come in handy too. What's your specific diagnosis? Again, what type of cancer do I have? What is the stage, and what does that stage mean? Because you can have a stage because stages can then be both, and for some types of cancers can be broken down again and sort of have multiple stages within a stage. Not a lot of them do, but a few of them do. So making sure you understand what the stage means. What are the symptoms that may be experienced of just the cancer diagnosis itself? Testing, what testing will be needed? Will labs need to be drawn? And if you want a second opinion, where to get one? And you're entitled to a second opinion. So know that you can always ask for a second opinion. Excuse me. So choosing the healthcare team. Again, there are oncologists who are well-versed and their expertise is in a certain type of cancer, and even maybe a particular stage within that. So that may affect who you ultimately decide to go to as a physician. And a personal preference can be with that too. And unfortunately, as much as I hate to say this one, sometimes insurance plays a part in the coverage of who you can see and where you can go. And again, those logistics we talked about earlier, transportation, if you have to drive a distance, if it's an issue of being in a rural community and having to drive to a hospital that may be in a larger city, and cost. So again, that goes into insurance, all of those things. These all sort of play a part together, these four things, and can be sometimes hard to piece out individually. Potential members of healthcare teams, you can have any of these, any mix of these. So a medical oncologist, nurses, a surgeon, a surgical oncologist, the pathologist or radiologist, a radiation oncologist, a dosimetrist who is actually somebody who is certified in developing the radiation treatment plans, a radiation therapist, a medical physicist, a general practitioner, and a social worker. And there may be some level of some of these all playing together and on the team to help you get the care that you need, the care that you want, and can answer they may not be able to answer all of your questions, but somebody in that list should be able to answer to the point where all of your questions can get answered. Also a pharmacist, psychiatrist, or psychologist, again, going back to that, just getting that personal support if you need it. Registered dietitian. Many people do want to change a diet, and the diets food can be affected by, and taste of food can be affected by treatment. So dietitian may be able to help you sort through that and find foods that you like and that will be nourishing and taking care of you through your nourishment. You may need a plastic surgeon depending on the surgery. A rehab specialist, home health aid, sometimes you're just in a point where you need a little bit of help through the treatment, and home health aid can help do that. Hospice care or palliative care, and of course clergy. Those are all potential members of your treatment team and your healthcare team. So preparing for your visit. Write questions down before you go to the doctor. So I recommend that you actually keep a notebook, that you just keep a notebook, that you know where it is, so that if you're not in the room where your notebook is, that you know where it is and a question comes, you can go and write it down. So you keep that in that notebook. It's less likely to get lost than an individual piece of paper. Bring that notebook to your appointment and make sure that before you walk out of that room, if it's possible, that all of your questions have been answered. Many doctors these days are willing to record your visit so that you can go back and listen to it. Many phones these days have that option for recording. Please do not record without talking to your doctor about it. But most of them, many of them, should say many of them because I can't give you any specifics on that, are going to be willing to let you record that conversation. Again, bring that friend or family member to take notes. Maybe give them the notebook where they can take notes. That will help you so that you're both taking notes, that you can then go back and compare. That will allow you to go, oh, well, I missed hearing that. So what did you hear on that? And get a little bit more clarification of what somebody else may have heard. And please talk about all medications, supplements, over the counter, anything that you might take, because there are supplements out there that can affect the efficacy of a treatment. So it's important for them to know what you have been taking. What you can do. So it can become overwhelming to think I have to make all these decisions right now and I have to do it all at once and it needs to be immediate. Give yourself some time, breathe through it, allow yourself to make decisions, decide sort of what decisions need to be made first and sort through that and sort that out so that it can be so that you feel less overwhelmed about the decision making that needs to happen. If you need to, sit down with insurance or financial counselor. Many centers have that. Sometimes the oncology social worker can help you with that. Help you put into place things that you need to support you financially through treatment. Do your best to check in with your feelings, and they may change from moment to moment. Excuse me. They may change from moment to moment what those are and what you need around that. And then take advantage of those resources, whether that's a counselor, whether that is, again, the support groups or financial. There are some, quite a few financial options out there for some patients. So just see what you can do to take advantage of anything that will offer you support. And that's going to vary from moment to moment, from individual to individual, from day to day. So know that this can all change as well. You may need to review everything and then make changes to it as you go along, and that's okay. So talking about some of the different treatment options that are out there. When making a decision around treatment, go back to those goals that you may have sorted through earlier. What are your goals for treatments? What are benefits? What are side effects? So kind of looking at pros and cons of different treatments. And for some people, there aren't options. One treatment is what's available. And what is their reason behind the treatment choice? And again, cost. All of that plays a part in making decisions around the treatment. So, guidelines versus pathways. There's a lot of focus on having evidence-based standards for cancer care. This is how we can make informed treatment decisions and how doctors can get informed consent so that they are giving their patients all of the information they have available to them at the time. So guidelines and pathways. So guidelines are just a specific subtype, maybe a genomic profile or stage of cancers. And these often have panels that consist of specialists within that cancer, within that maybe subtype of cancer, kind of depending on what it is. Also, you'll find experts in the psychosocial care and patients sometimes help make these guidelines. So they get involved as they're going through treatment or have gone through treatment to help determine what is going to be beneficial to the other patients. And these guidelines are developed on what is known to work best for the treatment. And again, cost comes up, and just because cost typically does not impact the guidelines. Pathways, on the other hand, are for ensuring that patients receive the most proven therapies that are out there and available now. And hopefully, you know, it's quality of care and avoiding anything that may be unproven. These include preferred drugs, perhaps. And this is a time when sometimes an oncologist will receive a financial incentive for sticking with those particular pathways. So questions to ask about treatment options. Again, this kind of goes back to those goals we talked about at the beginning. What are the goals that you are seeking of treatment? And why is this treatment recommended? Why is this the recommended treatment? And again, what are the benefits and what are the risks? Those are important things to know. What are the risks? What are the side effects? Is neuropathy going to be something that could potentially affect you for a while? Is chemo brain a possibility? All of that, so that you can be prepared and thinking ahead to the potential possibilities of how you will be affected by the treatment and possibly manage side effects and get that started ahead of time. Again, how often will treatment be given? Is this a radiation treatment that's going to happen 5 days a week for 3 weeks? Is this a chemotherapy treatment that's going to be an infusion that you'll get once every 2 to 3 weeks? How is it given? Again, are you taking a daily pill, an IV infusion, just as I mentioned, all of those things? How long will the treatment last? Is this going to be something that happens for a month? Is this going to happen if you're taking it by pill? Is this going to be multiple months? What does that look like? Asking all those questions. And does the facility offer some kind of emotional support? Do they have a support group? Do they have counselor or a social worker you can talk to and that you can make an appointment while you're there, which can help with if there are transportation challenges, if you can sort of get 2 birds with 1 stone right there. There are many different treatment options: chemotherapy, radiation, surgery, targeted therapy, immunotherapy. I think many people, most of us, are pretty familiar with chemotherapy. We've all heard the word. Basically, the use of drugs to destroy cancer cells. It can be through an infusion, through an IV. It can be an injection. It can be by mouth through a pill. And in some cases, applied directly to a tumor. This is a systemic therapy, meaning you get chemotherapy, it's going to go through the entire body. Radiation. Is this an external radiation where a machine is going to deliver the energy right to a specific body area? These can often are once a day for several weeks. And there can be internal radiation where something like a seed or several seeds are placed into the body, liquid in some cases placed into the body, and to treat that specific area. In some cases, this may require some inpatient time as well, just because of radiation that the body may be giving off. Surgery is the most common form of cancer treatment and can be used alone or sometimes in combination with treatment. So surgery may be used to determine a diagnosis if they can't get a good diagnosis through an ultrasound or an x-ray. Can help determine staging, how far has the cancer developed. It can be part of treatment, so stopping it by either making the tumor smaller or removing it completely, and also in cases like breast cancer for reconstruction after mastectomy. So as far as targeted therapies go, They are, I mean, it is what it says it is. It's targeting a specific spot and targeting specific genes or possibly proteins. Excuse me. Can also be given as an IV, a pill, or an injection, but not all cancers is it possible to treat with a targeted therapy. And immunotherapies are the option with immunotherapy is using the body's natural defenses to kill cancer cells. And these are usually done through an IV. So as far as palliative or supportive care, many people hear the word hospice and that's frightening to them, because hospice for many says end of life. But palliative care can be done through a hospice. And this palliative care is focused on providing relief from symptoms, from pain, from stress. It can start at the initial diagnosis. It may not be needed at the initial diagnosis and will start later on. So it's to improve the quality of life, both for the patient and families and caregivers. So this is not hospice care. This is simply managing symptoms so that the patient is comfortable and caregivers feel supported as well and may need that support. Questions to ask during treatment. You may need to let the doctors know, the oncologists know, what side effects are affecting you the most. How are those side effects interfering with your life? And what can be done to manage those? If you're seeking a certain quality of life, and how can those be managed so that you can have that? Are there complementary therapies or treatments that may be helpful? Doctors should be able to refer you to a palliative care specialist so that you can be comfortable and get the treatment that you need and the support that you need. So, along with that notebook that you're keeping your questions in to ask your doctor, you might want to keep a notebook or maybe have a sectioned notebook where you can also track your side effects, where you can write them down, because then you can have that with your questions when you talk to your doctor or when you talk to the nurse practitioner or the nurse navigator. Keeping track of what they are. Is there a time of day that they're happening or a time of day that they're more severe? What they feel like, how they feel, and how they're impacting your life. And so that you can give your doctor as much information as possible for managing those side effects. So tools that can help with concerns that often come up with a cancer diagnosis or during treatment. Having a living will or an advance directive will allow your doctor to know what kind of medical care you want if you are unable to speak for yourself. A durable power of attorney names a person who makes health decisions for you if you are unable to do that. They will need, they're called a healthcare proxy, and they don't need to be an attorney. Financial power of attorney names that person who makes those financial decisions for you, for your home, for your medical care, again, in the event that you can't do so for yourself. You have a DNR, do not resuscitate or allow natural death order so that heroic measures won't be taken in the event that your heart stops or you stop breathing. And then a will states who will receive money, belongings, who's responsible for caring for children if necessary. Addressing for the caregivers. Again, it can feel like you need to rush to make a decision. Just remember, sort of slow down, take a deep breath, think things through, look at all the options, get questions answered for the caregivers as well as the patient. Cancer can leave people feeling very out of control, and if you can take back some of that control through managing questions, through getting the information you need, that will help be calming, that will help be soothing, and that will just help in general as treatment moves on. And again, just ask those questions. Be that advocate. Be that advocate for the patient if need be, so that everyone feels like treatment is moving forward as they want it to. The caregiver may be the person taking notes. And that's a good thing, because then they can hear what's happening and what expectations are, and feel like they have the information they need. And again, we already talked about comparing the notes, because people do interpret what they hear differently or miss things. And make time for yourself. It's going to be real important. I know we all hear you got to take care of yourself before you can take care of somebody else. And this is a truly, truly important in this case. Maybe it's 20 minutes to meditate. Maybe it's 20 minutes to step outside and take a quick walk. Maybe it's calling somebody to say, can you stay here for a little bit while I go run some errands? Whatever those things look like, don't be afraid to ask for them. I already talked about being selective where you find your information, knowing that you're using reliable sources, reliable websites, benefiting from the experience of others, and choosing a doctor that you really do trust and feel that you are getting what you need as far as communication, as far as treatment, and that you trust. So some resources. The cancer support community does offer the cancer support helpline. This is staffed by licensed professional counselors Monday through Friday. Cancer Experience Registry is just a community of people who have all been touched in some way by cancer. The idea is that they want to collect and share and analyze information about the experience to try to help improve patients and families and improve support throughout that journey. Open to Options is a great thing that Gilda's Club and the cancer support community offer. And I'm actually someone who is trained in the Open to Options. Myself and Clara within Gilda's Club, Kansas City, are trained in Open to Options. And this is an evidence-based program that really does help you prepare something to take to your doctor. So it looks at 5 aspects. It's gonna clarify your situation. What are the options? So these are the 5 aspects. So clarifying your situation, clarifying what you know about your treatment. So what are your options? Who is in your network? Who is involved in your care in some way? What are your goals and objectives? So clarifying those, and then an evaluation. So that's like clarifying the impact on you that are available within your goals. So what somebody who's doing Open to Options is going to do is really sort of suss out from you what you understand about what's happening within your cancer experience. They're not going to give any suggestions to you. And the reason for this is, and they're going to do any of, oh, you should check this out. The reason for this is you will leave your Open to Options with a written document of all of these things that you can take to your doctor that allows your doctor to read. It can be emailed to your doctor as well, or to their nurse. Sometimes that's how you need to go, is through the nurse. Because what can happen is that can show the doctor or the nurse that, oh, maybe there's a misunderstanding somewhere here. And that allows that communication to open. So that is a good option if you would like to take advantage of that at any time. And then our Frankly Speaking About Cancer series, which we do several throughout the year, and they vary from year to year and month to month, or calendar cycle to calendar cycle. What's available out there. If you want to register for the cancer experience, you'll just get a survey that helps them to understand where you are in your experience, and it is confidential and secure. So it's just kind of a quick timeline of kind of how that's come to be over the years, and where the highlights have been within the Cancer Experience Registry. So if that's something you do want to join, you can go to www.cancerexperienceregistry.org and follow the steps, fill out the survey, and you will personalize a page. And then you can check back for education resources and new surveys that may be up there. This is more around the cancer support community and the Cancer Experience Registry for making sure that anybody who's been touched by cancer or who is a caregiver or is living with cancer gets the support they need. MyLifeline.org offers information, has a blog. There are some discussion boards, care coordinators, and a calendar that maybe can help you for coordinating any volunteers, meals, rides, errands that need to happen, anything that may need to happen that you need support with. So that completes the presentation, and we can open it up for questions and any discussion as soon as